Welcome to the February roundup of Coffee with Compliance. My name is Colleen Patterson, and I'm the Vice President of Employer Services and Compliance at Savoy. I will be recapping all of the happenings in the legislative and regulatory landscape that's occurred over the last month and are impacting employee benefits. So, the first topic that I have for you today has to do with the national emergency and the public health emergency. Now, I know we've talked about this a couple of times, but there are some clarifications that have since come out, so I wanted to touch on this again. So, just to recap, the COVID-19 national emergency and the public health emergency were declared by the administration all the way back in 2020, which at this point seems like a lifetime ago. The national emergency is currently set to expire on March 1st and the public health emergency on April 11th. Now, the administration's plan is to extend both emergency declarations to May 11th, ending them both on that date. So this wind down would align with the administration's previous comments, which was to give at least 60 days notice prior to termination of the public health emergency. Now, this also has to do with what we refer to as the outbreak period. And as a reminder, the outbreak period is defined as that period of time beginning on March 1st, 2020 and ending 60 days after the end of the COVID-19 national emergency. Now, the affected timeframes included things like COBRA notices, elections and payments, also HIPAA special enrollment period. So, for example, the ability to enroll in a health plan after a marriage or birth of a baby. And it certainly has an impact on the timelines for claims and appeal procedures, as well as any external review procedures. Now, the federal guidance allowed each individual beneficiary's outbreak period to expire on a case by case basis. And that was according to one of two things. One year from the date the individual was first eligible for deadline relief, or two, 60 days after the end of the national emergency period. So, what does all this mean? If the national emergency period ends on May 11th, 2023, which is anticipated, then the outbreak period will end 60 days later, which would be July 10th, 2023. So as a result, group health plans, deadlines, they're going to revert back to pre-pandemic timelines. So they're going to go back to the standard timing on July 10th, 2023. So plan sponsors, advisors, TPAs, service providers, they all need to be cognizant of how the deadlines will work and change over the course of 2023. So now the public health emergency has to do with first dollar coverage of COVID vaccines and testing. So what's going to happen with that? So under the public health emergency, private health insurance coverage can currently access COVID vaccinations and testing, including home tests. And of course, there's been no cost share for these things. If the public health emergency ends on May 11th, 2023, as anticipated, this guarantee as far as access to COVID-19 vaccines and tests without cost share will cease unless there is additional public policy action that's taken. Now, group health plan sponsors and health insurance carriers, they'll want to go and review certainly what they're going to be doing for COVID tests and vaccinations without applying cost sharing, but that would no longer be mandatory. So they have to make a decision. Are they going to continue to cover these tests and vaccinations without cost share, or are they going to require it? And what does that look like once the public health emergency is over? The bottom line is, though, they're no longer going to be mandatory to do so as of May 11th, 2023. So we are waiting to hear from the carrier community what's actually going to be happening there. So stay tuned for more information. Now, the other thing that's tied to the public health and national emergencies is the telehealth flexibilities that have occurred during this time frame. So many employer plans and providers expanded their telehealth coverage due to COVID-19's pandemic. The federal public health emergency allowed for suspension of certain telehealth prescribing and HIPAA high-tech privacy and data security requirements. And many states lifted provider licensing requirements to make it easier to perform telehealth services in those states. So some of these state level telehealth actions are limited to the length of the national public health emergency. So without further federal or state action, the telehealth services that some group health plans may offer may be more constrained if the public health emergency ends May 11th as anticipated. So we expect that federal officials are going to release more information on this as far as unwinding the national emergency, and certainly what does that mean for the outbreak period and all of these health related flexibilities that have been permitted by the public health emergency that have affected employer sponsored plans. So there's definitely going to be more information coming in the coming weeks and months. So stay tuned for that, and we will keep you informed as more information becomes available. So the next topic that I have for you has to do with Medicaid, and specifically Medicaid is part of the Consolidated Appropriations Act of 2023. So that was the omnibus bill that Congress had recently passed, and Congress had set an end to the FFCRA continuous enrollment provision that permitted individuals to remain on Medicaid due to the COVID-19 pandemic, whether or not they met eligibility requirements. So continuous enrollment is now going to end March 31st, 2023. So when the continuous enrollment provision ends, it's estimated that there's going to be more than 18 million individuals who could lose Medicaid coverage. So CMS is opening an ACA special enrollment period for those losing Medicaid coverage after the end of the continuous enrollment provision. The special enrollment period will run from March 31st, 2023 through July 31st, 2024. So those eligible will have 60 days after they submit their application to select a healthcare.gov marketplace plan. And coverage, as we know, starts the first day of the month after they select a plan. So keep an eye out for that, because that's ending here pretty quickly. Again, that continuous enrollment is going to end on March 31st. So moving along to another topic, this past month, it was on February 5th, that the FMLA turned 30. So back on February 5th, 1993, President Bill Clinton signed the FMLA into law. So the United States is only one of 6 countries in the world, and the only wealthy country, without any form of national paid leave. Every year, employers are increasingly offering their employees paid leave to attend to significant family and medical needs of their employees. So fast forward now 30 years later to this past week when, or actually a couple of weeks ago, when President Biden, during his State of the Union address, made a plea to make sure that working parents can afford to raise a family with sick days, paid family and medical leave, and affordable childcare that will enable millions more to be able to work. So the president's comments are a reminder of the American Families Plan that President Biden had proposed back in 2021, and that's been debated multiple times since. However, this topic is expected to continue to gain more momentum, so we're keeping a close eye on seeing what happens as it relates to policy changes. So stay tuned for that as well. Now, the last topic that I have for you for this month is really a hot topic, and it continues to remain a pretty hot topic, and that is the RxDC reporting. So we, along with all of you, we've received multiple questions regarding the data collection survey or forms that recently have been sent out by some carriers to their clients. And we've gotten a lot of questions as a result. So I wanted to just take a minute or two here and go over some of the common questions that we've received so that we could share this with all of you. So the question that always comes up is, well, why are the carriers asking clients to complete a survey now when they didn't have to with the last reporting deadline that was in January? That's a really good question. So the answer is the departments had released FAQs at the end of December, which, as we know, provided much relief for plan sponsors, TPAs, and carriers. And in that relief was a good faith effort, safe harbor, which means for the first round of reporting, do your best to get it right and make any necessary adjustments before the next reporting deadline, which is set for June 1st, 2023. So after this first round of reporting, carriers realized there's information that they just don't have access to or know about the clients. And as a result, they have to be able to figure out a way to be able to gather this information. So what they've been doing is asking clients to submit information through the use of an online form or a survey that they've been sending out. And it isn't necessarily going out to every single group. So it is important that if your client does receive a request from the employer, that they do complete the request and they complete it timely. Because if they don't, it brings us to the next question, which is, well, what are the penalties if the group doesn't complete the form? Or for that matter, doesn't comply with the reporting? Another great question. So here's the answer. The carrier will then only report the information that they do have, which means it's going to be incomplete. Ultimately, as we know with all of these things, it's the plan sponsor's responsibility to ensure that they have complied with the requirements. HHS is the enforcing agency, and HHS has said that they intend to address the issue of enforcement under the Public Health Service Act and expected to enforce the requirements to the full extent of the law. So what are the penalties? So non-compliance could result in an imposed civil monetary penalty, as well as could affect obviously plan sponsors, but also insurers as well. So if you have a client that receives these forms or surveys for a request for information, it is to everyone's benefit to get them done timely. Now, the next question that we've been getting to is, are TPAs to administer HRAs, FSAs, HSAs, and even an EAP, do they have to be included in the reporting? Again, another great question. So the answer to that is no, and here's why. HRAs, HSAs, and FSAs, they are account-based plans, and therefore they're not subject to the reporting. As it relates to an EAP, EAPs are accepted benefits, which is also excluded from the reporting. Now, the last question that we've been getting, and this is one that I think is a really good question too, is what is meant by the term member? So this is something that gets interchanged, I think, all the time when we're talking with clients and participants and carriers, that this term always gets kind of used interchangeably. So the instructions define a member as anyone enrolled in health coverage, including employees, enrollees, dependents, and participants. So this means when counting covered members, this includes dependents. Also, then calculating average premium paid by a member, this would include contributions that the member paid for their dependents. So it's everybody. Now, another important thing to know about the RxDC reporting is that it's based on a calendar year. Now, CMS refers to this as a reference year, which could kind of be confusing. However, it means the same thing, which is a reference year is the same as a calendar year. So the reporting that is due June 1st, 2023 is for the 2022 calendar year, or as CMS is calling it, a reference year. Now, we've been getting some questions about, well, how does that actually work then for non-calendar year plans? So under the plan list information, non-calendar year groups should enter the actual beginning and end dates of the plan year, even if they fall outside of the reference year. The employer should enter the actual beginning and end dates that encompass the reference year, even if it falls outside of the reference year that they're reporting for. So what does all that mean? Here's an example. If the plan year is July 1st through June 30th, the reference year is calendar year 2022. So that means under the plan list, the employer would enter the information as follows. It would be on two separate lines. The first line would be July 1st, 2021 through June 30th, 2022. The second line would say July 1st, 2022 through June 30th, 2023. And the reason for that is because the reference year is the calendar year of 2022, but the plan year starts off calendar. So it's a non-calendar plan year. So you have to be able to outline the dates as it relates to the actual plan year when it is. So in this example, it was July 1st to June 30th. So it's going to go over the span of another calendar year. But you're only going to break that out based on the reference year that you're using. So again, the example is July 1st, 2021 through June 30th, 2022. The second line would say July 1st, 2022 through June 30th, 2023. Now, the other thing that we keep getting asked about is data files, and what does that mean for this calendar year? So in the data files, a non-calendar year group adds information for the 2022 calendar year. So again, an example of a July 1st group would only enter the actual data for calendar year 2022. Now, this CMS had put out a instruction booklet, and it's the RxDC reporting instructions booklet, and it has great examples outlining how a non-calendar year plan can complete this information. So definitely check that out. There is a link to it on our website as well under our RxDC resources. And in addition to that, we also just recently released an RxDC carrier guide that outlines what the carriers are doing as it relates to whether or not they are requesting a survey from their clients to gather some of this data before the June 1st, 2023 reporting deadline. So if you want to find out what a carrier is doing, feel free to navigate over to our website and check out the RxDC carrier guide. So that's going to wrap up everything for me this month. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use all of the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe, and thank you for joining us today.